Hi, this is Dr. Ryan Bentley, and I want to ask you a question. What if I could share with you 3 great things that would benefit your patients, your practice, and your community? Would you give me a few minutes of your time? If so, then spend the next 10 minutes with me because I want to show you how the RJL BIA training is great for your patients, for your community, and for you and your business. I believe the best thing that we can do as healthcare providers is to use our skills and expertise to benefit the lives of the patients we care for. I have also found that in healthcare, the authority and the expert is the person that people want to see, and is also the professional that people are most likely to pay. The RJL BIA training I am providing you will give you the knowledge to become the authority and expert in utilizing RJL's bioelectrical impedance devices in your community. So here are the 3 great reasons why this training will benefit you. Reason number 1, you'll have objective data to share with your patients. The great thing about objective data is it's objective. It doesn't rely on guesswork or how someone feels, especially since symptoms are the last thing to show up and the first thing to go away. Many of you can relate to this story. I had a patient come in to me for weight loss. She did everything I asked. She was eating right, she was exercising, and in 2 weeks, she weighed exactly the same. She was back in my office, and when I walked in, she was sitting there sobbing. I said, "What's wrong?" She goes, "I don't get it. I'm eating right, I'm exercising, I'm doing everything you've asked me to do. I feel better, my clothes are fitting better, but I'm still 166 pounds. I said, "That's great news." She looked at me with these dumbfounded eyes, and I said, "Look, you've lost 4 pounds of fat, you've gained 2 pounds of muscle, and you're retaining 2 pounds of water. And this water retention is most likely because your muscle is 73% water. That's good. It's all about composition and not about a scale." She was excited when she walked out, she was smiling, and then she sent in 2 more patients. The point of the story is that you have to be able to measure, monitor, and manage. The problem in today's healthcare is most people are measuring disease, monitoring disease, and therefore managing disease. If you want to be the health and wellness clinic in your community, then you have to have a way to measure health and monitor health and manage health. And that's where the RJL BIA training comes in handy. Reason number 2, you'll be able to use the RJL BIA training to create a customized program for your patients. As you know, anytime someone offers something that is customized, it is more valuable because it is specifically designed for their unique needs. This allows you to have a program in your community that is personalized, predictive, preventative, and participatory. It allows you to personalize and customize it for each individual. It allows you to be predictive in nature, which allows you to be preventative and prevent the comorbidities that occur with unhealthy lifestyles. And also it's participatory on your part and on the patient's part. It's a win-win situation all around. And reason number 3, with this training, you can provide objective data, customize weight loss programs and health programs for each of your patients, and you can charge a fair price at the same time of running the tests on your patients, which will allow for you to prosper and profit all at the same time. When it comes to lifestyle medicine, too many practitioners are spending the majority of the patient's money on diagnostics to measure sickness, as opposed to spending it on getting healthy. With this training and the use of RJL's BIA, you can measure, monitor, and manage health affordably, which will leave more money for your patients to spend in your office on supportive things to help them achieve their health goals, such as medical foods and nutritional supplements, which, by the way, creates a nice residual income as people can buy from your online store 24/7 when your doors are closed or you're on vacation. I would like to take a moment and show you how the RJL BIA training can bring you a positive financial return. I believe that even the best training is only good if it brings you a positive return on your investment. So let me show you how this works. In my practice, I test people every 2 weeks with the BIA. I recommend that they get tested so I can see what kind of changes are occurring every 2 weeks and if there's tweaks that need to be made along the way. I charge $25 just for the BIA alone. So it's $50 per month in profit in BIA because it costs you less than $1. If you are working with a patient on a health and wellness program or a weight loss program, then you'll have a very conservative average of additional profits of about $100 from medical foods and nutritional supplements that you recommend that they buy in your office. I find that the average health and wellness program or weight loss program in my practice runs between 3 and 6 months. So I'll be using that as my timeline as estimates for you. So if we had that one patient at $50 of the BIA testing profits and $100 in profit from the medical food and supplements, you times that by 6 months, that's $900 of profit for that one patient. Now let's just be conservative and cut that in half, and let's say $450. So now ask yourself, how many patients do you have that could benefit from this testing? 5, 10, 20, maybe even more. Just use that number I shared with you and look at what it can do for your bottom line in your practice. Just testing 10 patients for 3 months can bring in an additional $4,500 into your practice. And if you do that every 3 months, or once a quarter you test 10 patients, that's $18,000 of additional revenue into your practice. That more than pays for your BIA device and the training that you have paid for. Now in my practice, in 18 months I generated over 1,500 new patients. And every patient that came into my practice for weight loss or a wellness program was tested. And I was able to show my patients that their hard work was paying off, and I was able to make a nice income doing so. Because if you do the math, and you look at this, if you test one new patient each day and they stay with you for 3 months, it's over $117,000 per year in additional revenue. And those are very, very conservative numbers. And I want your patients to have the same success that my patients have, and I want you to have the same success in your practice that I have in my practice. This is why I took my 10 years of RJL BIA experience and created this program. Now let me tell you about the program and show you a quick tour of the knowledge that you are going to gain that's going to allow you to become the authority and expert in your community. In Module 1, you will gain the physiological and clinical understandings of the dynamic changes that occur in the human body as it adapts to the environment that creates either health or disease. In Module 2, I'll teach you the different ways healthcare facilities measure body composition and why the RJL's BIA is superior to all other brands and methods in assessing the physiological changes to the environment with regards to the physical, chemical, and emotional stressors that our body is under the influence of on a daily basis. In Module number 3, I'm going to review with you how the BIA was developed and why it is the best data available, how it works, what it measures, its sensitivity and reproducibility. You are going to gain the understanding of resistance to electrical flow and how it relates to the human body, and also how capacitive reactance relates to the integrity of the cell membranes. You're going to understand the guidelines for using the BIA, when to use it, when not to use it, and how to use it, and also what limitations the BIA test has. In Module number 4, I'll show you how to best select the patient data and the importance of choosing the correct prediction equations and how to appropriately select which one to use to obtain the most accurate prediction of your patient's body composition. Module number 5 is going to be a video demonstration. I am going to teach you how to utilize and operate the body composition software to its fullest potential. This will allow you to become skilled in customizing the software to your particular needs. Specifically, I'm going to show you how to customize the definitions at the end of the report and also how to customize the diet section of the software program. In Module number 6, we'll have an understanding of the clinical applications of phase angle and how it helps us to determine cellular health versus cellular death. You are also going to be able to ascertain the information regarding the patient's essential fatty acid content and the integrity of their cell membranes. You will discover how to utilize phase angle as a prognostic indicator in the mortality of patients with conditions such as AIDS, cancer, and malnutrition. In Module number 7, we will be discussing the scientific and clinical relationship of fluid distribution. You will develop the skills to interpret the fluid shifts in the patients and how to create an effective protocol to help the patients improve their health status. In Module number 8, we will learn how to quickly, accurately, and cost-effectively measure aging in your patients within the convenience of your office or while you're on the go, as you will be able to measure 3 of the top 4 biomarkers of aging. In Module number 9, we'll be going through the understanding of body mass index and its limitations. You will learn the clinical significance of elevated BMI and its relationship to systemic inflammation that leads to the comorbidities associated with obesity. In Module number 10, we'll be discussing body fat percentage and why it's important to have not too much body fat but also not too little body fat. In Module number 11, we'll be discussing fat-free mass. You will learn the clinical significance of lean body tissue and its effect on human physiology and gain the full skill to differentiate muscle gain versus water retention while interpreting the patient's data. You will become skilled at educating your patient base that there is more to health than just weight on a scale, and it's all about composition, as one can be obese at 130 pounds. In Module number 12, we'll be discussing the difference between basal metabolic rate and daily energy expenditure. You will also learn how to utilize this information to accurately determine your patient's caloric needs to gain or lose weight while achieving their optimal health. In Module number 13, we're going to be talking about fat mass. We're going to have an understanding of the laws of thermodynamics and its relationship to fat mass and calories. With regards to calories, we'll have an understanding of the role that food plays and also be able to determine the exact amount of protein your subject needs based off of the BIA results. Module number 14 will be a video demonstration of the Diet and Exercise tab. You will gain the skills to efficiently and accurately create a fat loss or lean muscle gain program with the body composition software. This demonstration will help you provide your patients with the exact amount of calories desired to facilitate weight gain or weight loss. In Module number 15, we'll be discussing cause and effect. We will learn how refined sugar can have a detrimental effect and destroy any attempt at becoming healthy. You will gain an in-depth understanding of the physiological web-like interconnections of excessive sugar intake and its detrimental effects. You will learn how to clinically assess and where to intervene. In module number 16, we will be discussing all causes of cellular injury and how they affect all parameters of the BIA as we look at real case studies. Module number 17, we will be discussing the basic physiological effects of stress, where you will understand the principles of the fight or flight stress response and realize the clinical manifestations, how to measure, how to monitor, and how to manage stress in patients while utilizing the BIA. Module number 18 is clinical rounds. In this module, you will be able to see how the information that you have learned can be implemented to manage complex patients. We have 3 cases that we will be discussing. A case of someone that has chronic inflammation, they're systemically toxic, and metabolic syndrome, while also having some single nucleotide polymorphisms. Case number 2 will be a 30-year-old woman who has a problem losing weight postpartum. Case number 3 is a 62-year-old farmer who wants to become healthy. The very first month, he lost 4.6 pounds of fat. Within the next month, without any change in his protocol, he lost 31.7 pounds of fat. I will be discussing how that phenomenon can occur without any change to his program. In module number 19, we'll be discussing the basic principles for nutritional protocols. I will show you how to understand the specific methodology for choosing nutritional protocols to assess patients as they can achieve their optimal health. We'll be discussing inflammation, detoxification, carbohydrate metabolism, and adrenal stress. I know this is a large amount of material to go through, but remember, you can take this one step at a time. This material is available to you 24 hours a day, 7 days a week. Take this training at your own pace and you won't be overwhelmed. You can do this. Just remember, just like driving a car, the first time you were overwhelmed, and now it's a reflex. Michael Jordan did not start out as a great basketball player. He practiced and continued to learn until he became an expert. You can do this, and I am here to help you. So if you would like for me to help you become the RJL BIA expert, then click the Add to Cart button below and let's get started right away. I look forward to working with you. Have a great day.